From KETK, you're watching East Texas Live.
The following segment is sponsored by the Sleep Medicine Institute of Texas. Welcome back to East Texas Live. With the Olympics right around the corner, Dr. Guge with the Sleep Medicine Institute of Texas is talking to us about athletes' performance and sleep. Thank you so much for being here today.
You're most welcome. It's a pleasure to be here.
Yes, sir. So, you say athletes have, they have a stool of 3 legs: training, nutrition, and recovery. So how big is sleep going into their recovery?
Sleep is very big. In fact, the National Sleep Foundation says that athletes should try to get 9 to 10 hours of sleep each night, not just before a big game, but during the entire competition season.
Yes, sir. And so do you feel like athletes training schedule, they train and schedule more sleep into their recovery than in off season?
Well, I think athletes don't spend enough time sleeping during competitive and on season as well as off season. Most of the effects of a good sleep for an athlete are to improve physiological performance. Their body repairs the tissues and the cells of the body. The heart gets rest. Then there is psychological improvement. It keeps them away from depression and allows their cognitive skills to work great and to help them adapt to changes and changing times and changing challenging situations on and off the court or field. And of course, the immune system works so much better when an athlete gets enough rest at night and can ward off infections and stay healthy during the season.
Yes, sir. How does getting less sleep and programmed into their, routine affect athletes, during the competition?
Yeah, I mean, if you're not sleeping well, your muscles are tired, your brain is tired, your body is tired, and being able to focus on sports is not possible. They've shown that athletes who get less than 8 hours of sleep have 70% higher chance of injury and almost 300% increased risk of making wrong decisions while they're on and off the court or getting sick, like getting sore throats and bronchitis, which obviously affects their performance.
Yes, sir. What kind of athlete or kind of things that athletes tend to avoid getting into during competition and prep in order to be able to get the most out of their sleep recovery time?
I think most athletes agree that drinking alcohol is perhaps deleterious to their repair function and their sleep, and so they try to avoid alcohol during competition, especially before big games. I think the other aspect is trying to avoid excessive ingestion of caffeine. Caffeine can race your heart, can cause more jitteriness, poor performance, coordination of skills. And so these are some of the things they try to do. They try to avoid going out late at night, to parties. And of course, parties means drinking, parties means, getting less sleep. And so most athletes will agree that they don't want to do that, so they try to sleep in earlier. But the problem with most athletes is that they don't do that during the entire competition season. They just do that before big games. And they really need to focus on getting 9 to 10 hours of sleep during competition, and off season at least 8 to 9 hours of sleep.
Yes, sir. Is there anything else you'd like to add?
Well, sleep efficiency is a big deal in athletic performance. If you sleep adequate hours, but if your sleep efficiency is less than 85%, then you're not getting recuperative or refreshing sleep. We actually have an app called the AI Omega app, AIOMEGA app, that plots your sleep efficiency, tracks it, and allows the athlete to show how good sleep they're getting, deep sleep, REM sleep, and amount of sleep.
Yes, sir. Well, thank you so much for coming in and telling us all about that.
It is my pleasure, indeed.
Yes.
Thank you very much, David.
Yes, sir. For more information, you can go to the website right here on your screen. The previous segment was sponsored by the Sleep Medicine Institute of Texas.